Welcome to www.drsilmansmilespa.com. Teeth whitening. Having a beautiful smile may be even easier than you think. Many people achieve the look they've been dreaming of with our simple bleaching procedure. What are the details of teeth whitening? It's safe, quick, and inexpensive. Just let us know at any appointment if you would like to whiten your teeth. You can lighten only your upper teeth or both the upper and lower, depending on how much you show when you talk and smile. In only a day or two your custom bleach splints will be ready for you to pick up. We provide you with a special bleaching agent that you put into the clear splints. With only a few hours of wear per day, our special bleaching agent bubbles stains right out of your enamel in a very short time without altering tooth structure or existing dental work in any way. When your teeth reach the desired brightness, only occasional treatment is needed to maintain your new smile. We'll want to take after photos at your next appointment. Dental bleaching can be used to correct tooth discoloration. Discolorations can be caused by staining, aging, or chemical damage to teeth. Using the latest in bleaching technology, we can offer a safe method for creating a beautiful, brilliant smile. In cases of extreme tooth discoloration, crowns or veneers may be the only choice, but because of the low cost of bleaching treatments, bleaching is nearly always worth a solid try. How is teeth whitening done? Key benefits of teeth whitening. Corrects brown, yellow and spotted tooth staining. Works on people of any age as a near-permanent solution for a dull smile, restoring brightness and brings the smile alive. An impression is taken to make a specialized mouthguard or stand to hold the bleach against the teeth. The material is used each night for about 3-4 hours for a week or two, and at the end of this time, significant whitening will occur. In some cases, the change is nothing short of brilliant. For confidence in appearance, bleaching technology allows us to promise improvements in yellowing, aging or stained teeth. For very severely stained teeth, crowns or porcelain veneers may be more appropriate. Considerations for teeth whitening. Over-the-counter bleaching agents are available for purchase at drugstores and pharmacies. However, since these products can cause harm to the gums and teeth, it's better to use products that our practice recommends. Your initial appointment usually will consist of an examination and review of your treatment options. Usually, treatment can be done or started the same day as the consultation. However, a complex medical history or treatment plan will require an evaluation and a second appointment to provide treatment on another day. Please assist us by providing the following information at the time of your consultation. Any X-rays taken by a previous dentist, if applicable. A list of medications you are presently taking. If you have dental insurance, bring the necessary completed forms. This will save time and allow us to help you process any claims. Please alert the office if you have a medical condition that may be of concern prior to treatment, that is, diabetes, high blood pressure, artificial heart valves and joints, rheumatic fever, etc. or if you are currently taking any medication, that is, hard medications, aspirin, anticoagulant therapy, etc. X-rays. If your dentist or physician has taken X-rays, you may request that they forward them to our office. If there is not enough time, please pick them up and bring them to our office. If additional X-rays are necessary, they can be taken at our facility. Dental amalgam. Dental amalgam is a commonly used dental filling that has been used for over 150 years. It is a mixture of mercury with at least one other metal. Amalgam has many advantages over other restorative material, such as low cost, strength, durability, and bacteriostatic effects. Amalgam is used in dentistry for a number of reasons. It is relatively easy to use and manipulate during placement. It remains soft for a short time so it can be packed to fill any irregular volume, and then forms a hard compound. Amalgam possesses greater longevity than other direct restorative materials, such as composite. On average, most amalgam restorations serve for 10 to 12 years, whereas resin-based composites serve for about half that time. However, with recent improvements in composite material science and a better understanding of the technique sensitivity of placement, it should be noted that this difference is decreasing. There are circumstances in which composite white filling serves better than amalgam. When amalgam is not indicated, or when a more conservative preparation would be beneficial, composite is the recommended restorative material. These situations would include small occlusal restorations, in which amalgam would require the removal of a more sound tooth structure, as well as in enamel sites beyond the height of contour. The American Dental Association Council on Scientific Affairs has concluded that both amalgam and composite materials are considered safe and effective for tooth restoration. Dental sealants. Highly effective in preventing decay on the biting surfaces of your chewing teeth, dental sealants are a simple procedure in which a tooth-colored acrylic coating is painted onto the surface of the tooth. This effectively seals the deep grooves, acting as a barrier and protecting enamel from plaque and acids. Sealants protect the depressions and grooves of your teeth from food particles and plaque that brushing and flossing can't reach. Easy to apply, sealants take only a few minutes to seal each tooth. Sealants hold up well under the force of normal chewing and can last several years before a reapplication is needed. Children and adults can benefit from sealants in the fight against tooth decay. It's highly likely that you may already know people who have undergone dental implant treatment and hopefully their experience has been positive. Dental implants can be excellent for replacing missing teeth, and this treatment is fast becoming the gold standard for dealing with tooth loss. In spite of this, how much do you know about the treatment and what to expect? What is a dental implant and how does it work? Dental implants are actually pretty straightforward, generally consisting of 3 separate parts that include an implant post or screw that is inserted into your jawbone, an abutment that is attached to the implant post or screw and which protrudes just above your gum line, and the final tooth restoration that will cover up the abutment. The idea behind using a screw or post is that it will bond with your jawbone during a process called osseointegration. This is where new bone cells begin to grow on the specially treated implant post, eventually holding the post firmly in place so it cannot move even a fraction. This bonding process helps to ensure the implant post is strong enough to hold a replacement tooth. Dental implants can be used to support implant crowns, bridges or complete dentures. Why is dental implant treatment often better than other alternatives? One of the reasons why implant treatment can be better than other alternatives is because of the way the implant post artificially replaces a tooth root. Your natural tooth roots are important for good dental health. Every time you bite down on a tooth, the sensation is transmitted through the crown of the tooth or the part you can see in your mouth, right down through the tooth root and out into the surrounding bone. This has the effect of stimulating the bone so that any old bone cells are continually replaced. Once a natural tooth root is removed, this no longer happens and old bone cells are no longer replaced and the jawbone gradually begins to resorb. Most of this resorption takes place the first year after tooth loss, which is why it's so important to think about replacing lost teeth as soon as possible. Dental implants can also be more aesthetically pleasing, especially when used to replace single teeth. A top-rated dentist can create beautiful new implant teeth that are amazingly realistic, using the highest quality materials. We make sure these teeth are designed to provide the correct amount of support for your cheeks and lips, avoiding that sunken-in look that can be so prematurely aging in people who have suffered multiple tooth loss. This treatment can be fantastic for people who have uncomfortable dentures and who hate being limited to easy-to-chew or softer foods. With dental implants, eating should be more pleasurable and teeth will be held firmly in place, making it easier to socialize with complete confidence. For people who lost teeth many years ago, replacing them with implant-supported teeth can also help rejuvenate their appearance, as often the dimensions between their upper and lower jaws will have been diminished by bone loss. Restoring the correct dimensions provides the proper support for cheeks and lips, helping to fill out fine lines and wrinkles. Getting started on the treatment process. If you are missing teeth or are facing tooth loss, then initially you will need a consultation with a good dental implant dentist. During this first consultation, a dentist will closely examine your mouth and will want to know your medical history to determine if dental implants will be helpful for you. Generally, Dental implants can be used to treat most cases of tooth loss, but there are occasions when an alternative solution may be preferable. A really good dentist will carry out a very careful assessment and only recommend implant treatment if they feel it's suitable for you. If you decide to go ahead, your dentist will need to take X-rays and a carrot scan, and we may want to take photographs and possibly dental impressions to plan initial treatment. This might seem like a lot, but when the time comes for the actual surgery, it's important for your dentist to know exactly where to insert the dental implants for optimal results, and this ensures treatment is faster and more comfortable for you. What to expect during surgery? The actual procedure to insert a single dental implant is surprisingly quick and can be completed in as little as an hour. Often treatment can be completed under local anesthetic, but it's up to you, and if you are nervous then please talk to your dentist so they can provide you with additional sedation. The best dentist will want to make sure you feel comfortable at all times and are relaxed as possible during your visit. If you require multiple dental implants, then it will take a bit longer and additional sedation might be helpful. Once the implants are in place, they must be left to heal and integrate with the jawbone, and this generally takes at least 3 months. One thing we know lots of people worry about is if they will be left without teeth, and we would like to reassure you that we will not leave you without a smile. With some implant treatments, it's possible to attach new teeth quite quickly, but your dentist will always provide you with some sort of temporary restoration that should look and feel pretty good until your permanent teeth can be fabricated. Your dental office will also give you loads of information on how to care for the surgery site while it heals. It's not unusual to feel minimal discomfort, if anything at all, particularly after just having a single dental implant. However, a prescription for pain relief can always be provided, or advice on over-the-counter painkillers just in case you are at all uncomfortable once the anesthetic wears off. Completing treatment. Once your implants have fully integrated with your jawbone, we can provide you with your permanent teeth. These will look far better and will feel more comfortable than your temporary teeth, and you will be able to use them to bite into food and to chew quite normally. Please visit our site to www.drsilmansmilespa.com for more information on Dentist New West Long Branch.